Presenting a new series, Medically Verbal, where we'll solve case history in just a couple of minutes. Disclaimer: these case studies are for understanding purposes. Inaccuracies may be present. Do not attempt these processes without the guidance of a licensed medical professional. Case 14. Chief complaint. A 55-year-old male presents to the outpatient clinic with complaints of gradually worsening shortening of breath and productive cough over the past few months. The patient reports increasing dyspnea, difficulty in breathing on exertion, which now limits his ability to climb stairs or perform activities of daily living. He also describes a productive cough with yellowish sputum production. He denies chest pain, fever, or hemoptysis, which is blood found in sputum. His past medical history shows hypertension, history of smoking, 20 packs a year, history of smoking. He is currently on lisinopril for hypertension, quit 2 years ago. He doesn't use alcohol. His family does not have any history of lung diseases. Physical examination shows vitals: BP 140 systolic, 85 diastolic, heart rate 78, respiratory rate 18, temperature 37. His respiratory region shows coarse crackles, which is heard bilaterally, prolonged expiratory phase. Cardiovascular region shows regular rhythm, no murmur. His abdominal region is soft and does not present with any tenderness. Why are there coarse crackles? Why could the coarse crackles be heard bilaterally? When we are talking bilaterally, it means in both sides. The crackles could be heard because of presence of any sort of fluid, any sort of liquid present in those areas. Initial differential diagnosis: chronic obstructive pulmonary disease exacerbation, community acquired pneumonia, tuberculosis, lung cancer, bronchiectasis. Based on this presentation, what do you consider the most likely diagnosis, and what further investigations or management steps would you recommend? If you're thinking tuberculosis, you might be just right. Community acquired pneumonia. Pneumonia is a disease which is very contagious. So a place filled with the patients of it is very likely to give it to any patient coming in. Community acquired pneumonia basically means when the pneumonia is not acquired through a healthcare place. Bronchiectasis means whenever there is a lung airway damage, because of which the mucus accumulates at the base or at the sides. If you're thinking tuberculosis, you might be on the right track. How are we going to confirm it? We'll do a sputum analysis by making a culture of the sputum and check the sensitivity. We'll do an acid-fast bacilli stain and culture by taking the sputum, making a smear, dyeing it in the fuchsia dye, washing it with weak acid, and the colonies would retain the color. We'll perform a chest x-ray to see for the fluid buildup. We'll do a CT scan of the chest if we need it for further evaluation. We'll do the blood test, complete blood count, C-reactive protein, and arterial blood gas by taking the blood from arm, wrist or groin artery. Management: if we found out, let's say, COPD exacerbation, because sometimes it can coexist with tuberculosis, we'll put them on bronchodilators, albuterol, which is a short-acting beta-agonist, and ipratropium, which is anticholinergic, corticosteroids so that we could reduce inflammation like prednisone, antibiotics, stromycin or doxycycline, oxygen therapy, of course when the SpO2 level is less than 88. For tuberculosis, we'll initiate the 4-drug regimen: isoniazid, rifampicin, pyrazinamide, and ethambutol. Ask them to stop smoking with this and provide them with support resources. Regular follow-ups and monitoring would be done to see how much of the treatment is working and adjust it accordingly. Hope you like the case study of today. You can come back whenever you want to sum it up. Please make sure that this is not a substitute of medical advice and is just for understanding purposes of how to diagnose and solve case histories. Directions or suggestions, comment down below. Make sure to like, share, subscribe, and hit the bell icon to never miss another update.